A very good afternoon to all our viewers today. I am Dr. Anushka, and today we have with us Dr. Praveen Kulkarni. A very good afternoon, sir.
Thank you,
Uh,
Dr. Anushka.
Let me give a quick introduction about Dr. Praveen Kulkarni. Dr. Praveen Kulkarni is working as a senior consultant cardiologist at Gleneagles Hospitals, Mumbai. He deals with various conditions like congenital heart defects, coronary artery diseases, heart failures, valvular heart diseases, etc. Some common types of heart diseases that he treats include rheumatic heart disease, hypertensive heart disease, ischemic heart disease, etc. He is among the first in India to use the revolutionary bioabsorbable stent in December 2012. As a big proponent of preventive cardiology and healthy lifestyle modification, he has participated in various health initiatives, including more than 100 community health talks. Across his professional journey, he has performed balloon mitral valvotomy, balloon pulmonary valvotomy, renal angioplasties, pacemaker implantations, among other interventions. Thank you, sir.
Yeah.
It's great to have you today.
Yes, thank you, Anushka, and
Yes.
thanks for that elaborate introduction as well.
Okay, so let's move on to today's topic.
Yeah,
Our today's topic is why heart diseases are on the rise.
yeah, and
Yes.
thanks for bringing up this topic. As you are aware, that September 29th is World Heart Day,
Okay.
right? So we are in the institute as well, uh, working towards bringing awareness towards heart disease, about healthy lifestyle, healthy cardiac healthy lifestyle related changes. So, and why is that relevant is because of your very first question. There is
Yes.
been a very rapid rise in the incidence of heart disease across all ages that we are seeing.
Right.
So in fact, to the extent that the last procedure that I did at 2 a.m. today morning, an emergency
Okay.
procedure, was in a 49-year-old gentleman.
Okay.
So, anyone coming in their 40s is now, we don't even blink an eyelid and wonder why he is having this heart disease. So, it has
Right.
become that rampant and that prevalent. Right? So, why is this change happening? So, there are, a lot of theories about it as to why we are, including there was a recent article in Nature. Now, Nature is the leading journal on science
Okay.
world over. So there was a particular article about why South Asians tend to have higher heart disease, why they tend to have
Okay.
higher rate of diabetes, and also what we now know as metabolic syndrome. I'll touch upon all these three because eventually heart disease is a continuum of metabolic syndrome, diabetes, pre-diabetes, and heart disease. So all
Right.
of them are in one continuum. Right? So the talk of sorry. So the incidence is whether is there a genetic predisposition, or is it just an unhealthy lifestyle that as a result of which, or is it a combination? So that is what the debate is. But if you look back, just say 2 decades back, the incidence wasn't as much or as prevalent as it is now.
Yes, I agree.
So this change in pattern cannot be explained if the predisposing factor was only the genetic factor, right? So
Yeah.
there has to be something new that has happened, and what is new that we are seeing in the society is our lifestyle that has changed, right? So the surplus calorie intake that we all of us now in our day-to-day life are exposed to, there is physical inactivity, right? So there was a recent study that came up. I think it was a WHO study, or where they saw the general health of of Indians, not just urban Indians, was generally much lower than this. The physical health of Indians is generally far worse than most other
Okay.
countries, including children.
Oh.
Okay. So what happens is the physical inactivity and the unhealthy lifestyle, poor dietary habits. This is now setting in the very first decade of our lives, right? Kids as young as 5 and 6 and 4 and 3 are now exposed to this poor lifestyle, right? So previously, the cumulative effect of all of this would take a few decades, right? So that's why whenever we talked of heart attack, heart diseases, it was typically in the 70s, late 60s or early 80s.
Right.
because the insult is now happening at a much younger age, including in the very first decade. In the very first decade, it is not surprising as a result of this that we are seeing heart disease and other related diseases very early in adulthood. 20s, 30s is not even a surprise anymore, right? So genes, yes, South Asian genes, there is a genetic predisposition, but again, there is no single gene which can explain why we are having all the heart disease here, right? So there are certain genetic predisposed cardiac illnesses. We call them cardiomyopathies, right? So where a certain genetic abnormality is noted, and they tend to have certain muscle abnormalities. Certain people tend to have certain rhythm abnormalities, but those are defined by a single gene. For now, there is no single gene which is going to explain all of it. So we are genetically predisposed, yes, but what is actually contributing significantly is our lifestyle.
And that is something which we can actually work upon.
Which we can, so, and see, most often when patients come to us and they say he was absolutely fine till yesterday, because apparently poor cardiac health is not shown in any overt physical sign, right? So there are symptoms which can be elicited, right? So most people say, we were absolutely asymptomatic till this happened. So the popular saying is heart attack can happen suddenly, but the process is never sudden, right? So the process of setting of that blockage of a heart attack would take months to years before a patient eventually develops a heart attack, and that is why the line, the adage of prevention is better than cure could not be better ascribed than for this condition that we are facing right now.
Absolutely. Right? So while we are speaking about heart diseases, what kind of heart diseases are we're speaking about?
Yeah. So see, when we talk of heart disease, we talk of the risk factors contributing to the heart disease and then heart disease itself.
Right.
So in the risk factors, two biggest risk factors is of hypertension and diabetes.
Okay.
Right? Now, hypertension, almost a third of urban India is hypertensive. Adult in Indians, one third are hypertensive. Sadly, very few of them are diagnosed, very few amongst them are treated, and very few amongst them are properly treated. Right. So if you take the subset of hypertensive adequately treated, it's a fraction of the total burden of hypertension.
Okay.
So untreated hypertension is a significant contributor for the heart disease. In fact, there is an entity called as hypertensive heart disease. So people in patients whose blood pressure remains high for a very long time, the heart tends to become stiff, it tends to become weak, tends to develop abnormal rhythm problems, and they eventually go into what is called as a hypertensive heart failure. So uncontrolled hypertension itself is a direct contributor for heart failure, and it also contributes to blockages. The other risk factor that we need to mention is about diabetes. So you really don't have to be an overt, long-standing diabetic to develop heart disease. So that is the paradigm shift in the understanding that we are having now. So there is an entity called as insulin resistance. What happens is normally insulin that is circulating in the blood helps push glucose into the cells. In metabolic syndrome, people who acquire insulin resistance, the same insulin is not able to regulate glucose metabolism adequately. So the people tend to develop resistance to insulin. So higher levels of insulin is pushed into the circulation. This ends up in a cascade, in a cycle of worsening inflammation. So what happens is the blood vessels start becoming inflamed. Right? So when they become inflamed, there is oxidative stress. Oxygen free radicals are released, lipid molecules go and deposit there. So it is actually like an inflammation where there is swelling, and that draws in more inflammatory markers, and eventually there is a pileup of all the lipid rich molecules there, which ends up causing plaque and which predisposes to acute heart attack or a blockage even. So insulin resistance pre-diabetes is equally important and it is contributing significantly to heart disease. As much as we all know, diabetes, once it is established, is one of the biggest contributors for heart disease. Right. So these two amongst the diseases, and third and fourth, which are equally important or more, is the diet and exercise that we just mentioned previously.
Exactly.
Yeah.
Okay. So, while we speak about these cases on the rise, some people also relate it to the breakout of COVID and the vaccines that
Yeah,
have been
so
taken.
you will be surprised. Almost every patient wants to attribute his or her cardiac ill health
Mm.
to COVID or its side effects
Mhm.
or vaccination and its
Yeah.
possible side effects. So there has been enough data to say COVID does leave some residual damage in certain organs, including the heart,
Mhm.
brain, some residual muscle insult or injury is seen in long COVIDs. But that in no way explains the rapid rise of heart disease in general in
Okay.
the society. Also, the vaccination, at least the vaccination that we Indians got, was not the vaccine that was associated with cardiac side effects.
Okay.
Or there were certain vaccines that were used in the West where there was an increased risk of clotting abnormalities.
Okay.
That was not the vaccine that we used here. So there is no direct correlation of COVID or COVID vaccination contributing to this rapid rise. And in practice, if you ask, most cardiologists and physicians would agree the risk factors and cardiac illness has been on a rapid rise much before COVID set in. Right? Exactly. It's only now with more awareness, with social media also driving awareness, sudden deaths in celebrities, in popular figures becoming highlighted, people are more and more aware about the rising incidence, which is in a way good. And I hope with rising awareness, there is also an equal stress and the change in lifestyle is initiated.
Right. So we spoke about the predisposing factors. So how can we, limit them, and how can we early detect any heart disease?
Right. Yeah. So limiting them, you will be surprised. There are two things that all of us should do. Right. So one is calorie restriction, especially in the form of pure carbohydrates, right? Trans fatty acid rich food. Right. In general, we have been previously, if you look, we have been a society which was short of calories. So our makeup, be it genetic makeup, be it our mental makeup, be our parents' makeup, all of us want that you are fed and you are fed well. Right? So that was relevant till a point when we were a poor country. Now, food shortage is not a problem. We are malnourished, but mal is not undernourished, we are overnourished. So malnourishment right now is about overnourishment.
Okay.
So overnourishment is not because we're just calorie excess, it is also the type of food that we are eating. Right? So if you see South Asian diet, predominantly Indian diet, uh, even if you consider non-vegetarians, the bulk of the calorie source is still carbohydrates. Right? And we say around 60-65% of your calorie intake has to be in the form of a carbohydrate. But our diet definitely far surpasses that. So higher carb intake predisposes to central obesity, predisposes to abnormal lipid profile, contributes to insulin resistance, and eventually contributes to prediabetes and diabetes. So excess intake of calories, poor calories is one of the biggest contributors. It was still pardonable if you're having the extra calories and working out and exercising and keeping yourself physically active to burn those extra calories.
Right.
That is precisely what is not happening with automation, with the general laziness in the society. We are not a very a society that is very outgoing in the form of public sports. So that is not a thing that is very common in a society. Even at school levels, academic excellence is more stressed upon than scholastic excellence is stressed more upon than sports performance, right? It's not looked up as a career option. So in general, the stress on sports and physical activity is lacking in starting from school level itself. And coming into adulthood with rapid urbanization, use of motorized vehicles, with easy access of mobile phones, the need to remain physical active is not a necessity, right? So if you have to be physically active, you need to do it voluntarily.
Right.
So most professions don't demand any physical activity now, right? Unless we are someone who is into manual labor, right? So, including us, sitting here, we may not necessarily be burning as much calories in a day that we should be.
Yes.
Right? So inadequate physical activity starting at a very young age, coupled with an excess calorie intake, these two are the very basis of which we are now leading into this pandemic of what we are seeing is heart disease in the young, hypertension in the young, diabetes in the young, and all the resultant diseases.
Yeah. While we speak about the young, there are many young sudden deaths as well
Yes.
pertaining to heart disease.
Yes. So you're right. Again, so sudden death in the young is there are two things or two lines of assessment that we do. One was there any predisposing cardiac condition? We
Okay.
spoke about cardiomyopathies. So any muscle abnormality, they can be genetic, where there's an abnormal rhythm that can set in and the patient can have a sudden death. So typically, this is seen in sportsmen. So suddenly, when they do high intense physical activity, and if they have undiagnosed cardiomyopathies, they are at risk of a sudden death. Two, there are certain arrhythmogenic heart conditions. So when I say arrhythmogenic, abnormal rhythm. So what happens in these hearts is one fine minute, one fine day, it just starts beating abnormally, and the heart goes into a standstill.
Okay.
So we call it sudden cardiac arrest, SCA. So the heart just fibrillates for a while and then it goes into a standstill. Okay. So these are rhythm related problems. So whenever we see sudden cardiac death in the young, these are one or two broad entities that we first look up at. Now, once these are ruled out, then comes the most prevalent cause of sudden cardiac death, and that is a heart attack itself, right? Okay. So, heart attack and cardiac arrest, I think these are two entities that we need to highlight that they are two different things, right? So, cardiac arrest is actually the stoppage of the heart because of any cardiac condition. It could be because of a rhythm problem, it could be because of a blockage. What the contraction of the heart just stops. So that is called a cardiac arrest. Right? In a layman's language, cardiac arrest is like equal to death. Okay, so that's why it is also called as sudden cardiac arrest or sudden cardiac death. Right? Versus a heart attack. Heart attack is not a arrest. Arrest actually means you've just grabbed someone and stopped their movement, right? So arrest is when the heart stops beating. In a heart attack, there's a blockage. The muscles are suddenly deprived of the blood flow in the heart and it becomes weak. There are rhythm problems, and as a result of which, some patients develop sudden cardiac arrest and die. If they don't, it leaves a muscle which is damaged and a heart that is weak. Okay. Right? And that is why whenever there's a heart attack, we always say that reach out to the equipped hospital at the earliest, because whatever blockage is causing that heart attack, if you open that artery at the earliest, either by way of medicine or by way of an emergency angioplasty, then you can restore blood flow to the heart and prevent further complications that are inherent in a heart attack. So, coming back to your question, being why we see that in the young, right? So, if it's not one of those cardiomyopathy or rhythm problems, then increasingly it is an acute heart attack, undiagnosed, which is the leading cause of sudden cardiac death.
Okay. So we spoke about the causes and the prevention part. So what could be the treatment if one develops any such heart
Right.
disease?
Yeah. So treatment always starts with prevention. So as I
Definitely.
said, first lifestyle changes. Regulate. All of us need to be very very regimental in how we regulate our diet and physical activity. Do health checkups. Have your blood pressure checked. Have your sugar checked. So diabetic patients who are undiagnosed, they also tend to overlook some of their symptoms. Hypertension usually causes no symptoms, right? So unless you have a health checkup voluntarily done, you are never going to pick up your cholesterol levels, your abnormal BP levels, or your high sugar levels. Right? Once you take care of these with either medications or lifestyles, the chances of one developing a heart disease significantly comes down.
Definitely.
Once someone develops a heart disease, so they can present to us in two forms. Either they come to us in the outpatient basis, where typically they come to us with symptoms of chest heaviness on walking, jaw pain, neck pain, shoulder pain on walking, breathlessness, excessive sweating on walking. So these are what we call as anginal symptoms. Okay. So there we usually go through the route of doing an ECG, a 2D echo, Then we do a stress test. If we find them to be abnormal, then we advise an angiography, or these days, increasingly, for such patients, we also advise a CT coronary angiography.
Okay.
So, CT coronary angiography also, in a non invasive way, tells us about the presence or absence of blockages.
Okay.
Right? So, this is, and based on what comes out in the angiography, we subsequently offer them either continuation of medicines, offer them an angioplasty, or if there are extensive blockages, then a bypass is suggested.
Okay.
The other set of patients are ones who come to the emergency. So we
Right.
use the broad term called as acute coronary syndrome, or ACS, where there's a blockage that has rapidly progressed to a point that there is chest pain at rest, there are ECG changes at rest, and there are certain blood markers called troponin, which can rise in the setting of an acute blockage.
Okay.
So, based on the severity of the acute coronary syndrome, we offer the subsequent treatment. In the most severe form, where we use the word heart attack, where usually a major artery in the heart gets completely blocked.
Okay.
Right? So, that is when you see pronounced ECG changes, marked symptoms, and that is usually the commonest cause for sudden death as well. So there, in centers like us, we offer them what we call as primary angioplasty, where the treatment is immediate angiography followed by an emergency angioplasty to open up that blocked artery.
Yes.
So once you open the artery, then the risk associated with the heart attack is taken care of. In centers which are not equipped to offer an angioplasty, a peripheral center, non-availability of cardiologists, then there are certain clot busting injections called thrombolytic agents. You give the injection with the hope that the clot that is blocking the artery will dissolve,
Okay.
stabilize the patient enough so that he goes to an equipped hospital eventually to undergo the angiography and subsequent angioplasty or bypass, as the case may be. So, depending on the presentation, the treatment also varies. Right? But once someone has a blockage, either be it in an acute setting or in a chronic setting, they will have to be on medications lifelong. The typical medications involve giving blood thinners, giving cholesterol lowering medications, and controlling and giving medications if they are hypertensive and diabetics. Yeah.
Okay. So while we come to the end of this session, would you like to give a message to our viewers about this topic?
Yeah, so I think with this month being in the 29th September specifically being a healthy heart day, we should take this month as a campaign of awareness towards good cardiac health, and the need for a healthy lifestyle cannot be overemphasized. I would, again and again in the talk I've been talking about, because I'm quite passionate and upset about the fact that it's our own unhealthy lifestyle that is leading us into this pandemic of increasing heart diseases. So, with good lifestyle starting from early childhood and regular health checkups, we can prevent most of these heart diseases. So, please take care of your health and please take care of your heart.
Thank you so much, sir, for this very informative session. I'm sure we have done justice to the World Heart Day,
Yes.
which is coming on very soon. Thank you so much to our viewers, and hope you all take care of your heart and
Yes.
stay healthy. Thank you.
Thank you, Anushka. Thank you.